Welcome to the July 2025 educational event. I'm Kavya Velagapudi, Executive Director of the Neuroendocrine Cancer Foundation.
I'm Lisa Yen, Director of Programs and Outreach.
And I'm Heather Davis, the Director of Community Engagement.
Today's presentation is on Living with NET, the patient perspective. A special thank you to our supporters, Novartis, Ipsen, Exelixis, Crinetics, Curium, ITM, Boehringer Ingelheim, and InterScience Institute. Neuroendocrine Cancer Foundation, previously known as LACNITS, provides a community of support and education for neuroendocrine cancer patients and caregivers. Our staff includes Lisa Yen and Heather Davis. Our board includes Donna Gavin, who is the sister of our founder Giovanna Joyce Mbezi and NET patient Mary Dunleavy. Neuroendocrine Cancer Foundation partners with the Carcinoid Cancer Foundation to provide its programs, including the Luncheon with the Experts and Support Line. Now I'll hand it over to Heather.
Thank you, Kavya. Our YouTube channel features over 450 educational and wellness videos, testimonials, and podcasts. Click videos or playlists to find additional patient and caregiver stories, information on types of treatments such as PRRT, liver-directed therapy, and targeted systemic therapies. There is information on imaging, nutrition, and our annual conferences. And you can also find our educational videos by topic in our video library on the ncf.net homepage. And please note, our webinars are created for educational purposes only and do not substitute for medical advice. The views shared in this webinar are from the patient's perspective and personal experiences only. Please contact your medical team with questions or concerns about your individual care or treatment. And now I'll hand it back over to Lisa.
Thank you, Heather. Today, we invite you to join us for an open and honest conversation with 4 individuals living with neuroendocrine cancer. Each of them will share their personal journeys, stories that are both unique and at times perhaps surprisingly familiar. You might recognize parts of your own experience in what they share, or your path might look very different, and that's okay. There's no one single way to navigate life with neuroendocrine cancer. This event isn't meant to represent every journey or offer a one-size-fits-all approach. Instead, it's meant to begin a meaningful dialogue. We hope it encourages you to reflect, ask questions, and connect, whether with your care team, your loved ones, or others in the community. And most of all, we hope it reminds you that you are not alone. I'm now going to welcome our panelists for today. Welcome to our Neuroendocrine Cancer Foundation July Patient Education event, Living with Neuroendocrine Tumor, the Patient Perspective. I'm pleased to introduce our special guests, David, Dusty, Judd, and Kimberly. We're so grateful to have the 4 of you to share your stories and insights on what it's been like to learn to live with neuroendocrine cancer. Many of our programs, as you know, focus really heavily on the disease itself, on treatments, scans, the emerging science, but we know that's only part of the whole picture. And at the center of all of that is you, the person living with cancer. Many of us in the community walk alongside you or others like you in different ways. Some of us, like me, walk parallel paths as a spouse, family member, or caregiver, and others offer support as clinicians, researchers, advocates, or drug developers. And we're all here for the same reason, to better understand you so we can better support you. And we also know you're so much more than a diagnosis. You're a whole person with experiences, joys, fears, relationships, a life that cancer touches but does not define. So we thank you. Thank you for your openness and generosity in sharing your perspective with us. And we're here to listen and to learn. I've had the pleasure of getting to know each of you, and I'm excited for the broader neuroendocrine cancer community to have that opportunity too. So I'll ask each of you to introduce yourselves, starting with David, then Dusty, Kimberly, and Judd. If you could, can you tell us a bit about yourself and who you are? And then also about your neuroendocrine cancer journey. We'll start first with David.
Hi, everyone. As you know, my name is David, and I am currently living in Northern California. By training, I'm a physician, and I came to Northern California to accept my so-called dream job after being at the University of California in San Diego for about 14 years. And I was invited to be the vice chair of the Department of OBGYN and the division chief of maternal fetal medicine, specifically with the goals in mind of starting a fetal surgery program, which was a personal interest of mine, operating on the fetus before it was actually born to try to fix problems, in utero. And I was here for about 6 months, and I was on call one night, and I had a small bowel obstruction. And recognizing the symptoms, I knew exactly what was going on. And I called one of my partners, and my spouse was out of town. And I asked that person two favors. One, could you take the pager and be on call for the rest of the evening? And secondly, could you give me a ride to the hospital? And I packed a bag because I knew I wasn't coming home. And I ultimately had surgery with a bowel resection and was awake the next day when the surgeon came in and said, you have something called a neuroendocrine tumor. There's no treatment, there's no cure, and there's really very little that we can offer you. And this is back in 2015. And with that, they got up and walked out of the room. And I was sitting there with my kids, and we all just sort of looked at each other a little bit dumbfounded. But that's where the journey began. So, having a strong science background, I immediately started searching for specialists in neuroendocrine cancers. And I did a cross search between NIH investigators and neuroendocrine cancers. And lo and behold, found two of them here in the Bay Area. Dr. Emily Bergslin and Dr. Pam Kuntz at Stanford and UC San Francisco. And so I made an appointment to see Dr. Kuntz at Stanford, and she recommended that I try a drug that had been FDA approved 2 months before that, Somatuline Depot. And I started that medication, and I've been on it ever since. Initially, the first few months were challenging, but I soon adapted and have had a fairly normal life ever since. So that's basically my story. Unfortunately, they did not know very much about neuroendocrine tumors, and they didn't know of any treatments. And after only a couple of cycles on the Somatuline Depot, they did not like the side effects that I was having. And they said, we don't think that you're a candidate to go in the operating room. And so we're going to give you two choices. One, you can retire, or two, we will fire you. And obviously, I retired so I would retain my benefits, but there ended my career as a maternal fetal medicine specialist. So that was a little bit harsh, a little abrupt. But what I didn't know at the time was that it was not the end of my career as a physician. So I've used my medical knowledge to become greatly involved in patient advocacy, and that's where I get to play doctor still.
Well, we're grateful for you. Thank you for sharing your story and how you've been on both sides and you've had to make some hard choices and decisions. So thank you for that. Dusty, let's hear from you.
Hi, my name is Dusty, and I live in West Virginia, in southern West Virginia, and I'm located in a fairly rural place, so our healthcare options here as far as NET specialists are limited. There is not a NET specialist in my state. I was diagnosed sort of randomly. I had a bit of abdominal pain. I hadn't had a lot of symptoms. I now know that I have a non-functional pancreatic neuroendocrine tumor, but obviously at the time of diagnosis, I didn't. I originally went in for a bit of abdominal pain, kind of at my sternum, thought it was probably a gallbladder attack. And my family physician ordered an ultrasound, went for the ultrasound. And I can remember during the ultrasound, talking to the ultrasound tech, and I mentioned something about having kids, and she didn't ask me any questions about my kids. And I remember thinking, that's weird. People always ask questions about my kids. And now looking back, I think because she'd seen something on the scan, she wasn't asking questions. She was too busy concentrating on getting the images that were needed. So then a couple days later, my family doctor called me. He said, hey, I'm so sorry. You're the last person I want to say this to or make this call to. But your ultrasound showed that you have lesions in your abdomen and it looks like cancer. And so what? Like, this is the last thing I expected. And it looks like cancer that is spread. So it's some kind of metastatic cancer. And it looks like it might have started in your pancreas. So all I'm hearing is metastatic pancreatic cancer. And so that was just a very shocking moment to have gone from feeling pretty normal and healthy and honestly just having a bit of pain that I didn't want to have to deal with. I was getting ready to travel overseas. Otherwise, I probably wouldn't have even gone in. I would have let it pass. And so I spent several weeks seeing local doctors and local oncologists who continued to look at my scans. And I was told it was most likely pancreatic cancer that had metastasized. It was possibly primary liver cancer, but most likely primary pancreatic cancer that had metastasized, and was told to be ready for the fight of my life, and that if I fought really hard, I might have 3 to 6 months to live based on the amount of disease that they were seeing. And so that was a very obviously traumatic time. I have 2 young daughters at the time. They were 4 and 7. And so, of course, that is the first thing that came to my mind. And faith is a big part of my journey. And so, of course, instantly my prayers were for my girls, that they would have their mom around and that I could be here to see them grow up and that I could be healthy and well for them. So that was my primary concern from the very beginning. Then fast forward, I had biopsies and things of that nature here in West Virginia, and a really wonderful local surgeon had gotten involved in my care. I had known him previously through other life circumstances, and he had gotten involved and done my biopsy and several different aspects of my care, including placing a port, because I was told as soon as they had the biopsy results that I would need to begin chemo. And so I had a port placed and was all ready so that as soon as the biopsy came back, we were going to fight this with whatever really, really strong aggressive drugs that would be needed for other types of cancer. And so after my biopsy, he called me and he said, so you have something called neuroendocrine tumors. I don't know too much about it. Honestly, it's a question on some of our, medical tests that we have to do for recertification. I think it's cancer, which now I know that it is, but I'm pretty sure this is good news. And literally that was the call that I had where I found out I had neuroendocrine tumor. It was very strange. And I had a PET scan that night. And so I had stayed in a hotel because I didn't really know if I needed to avoid my kids. So I was like, I'm just going to stay in a hotel so I don't bring that home. All the scans and stuff at the time were new to me, so I wasn't sure if I needed to be away from them at that time. So I was actually all by myself in a hotel room and had the evening to just research what in the world is pancreatic neuroendocrine tumor, what is neuroendocrine tumor. And so I quickly stumbled upon all the resources that are out there and spent the evening Googling and reading, and happened upon the NCF page. Back then it was LACNets, and sent a message and said, I'd seen all the US News doctors listings for different types of doctors, but there didn't seem to be one for neuroendocrine tumors. And so I sent a message saying, how do you figure out who the best doctors are for neuroendocrine tumors? And as a result, Lisa actually messaged me back and we began emailing back and forth. And from there, really quickly, I started to understand the resources that are available, the doctors that are available. and really went and on kind of a tour of neuroendocrine specialists in around the country. I really saw a lot of different individuals and made sure to explore the different options. It wasn't until the very end that I started to find consensus from the different doctors that I saw. So it was a very confusing and scary time. But the more I learned, the more I realized that this disease was a good answer for me. As far as now, I wasn't looking at 3 to 6 months. I was looking at 2 years, 3 years, 5 years, 10 years, 20 years. And then I started to connect with advocates. I connected with 2 wonderful advocates from LACNETs who were wonderful encouragements to me, who were diagnosed moms to young kids themselves. And that was an encouragement to me to hear their stories of how they had gotten to see their children grow. And as far as experiences before that might have been symptoms, I probably was symptomatic for several years prior due to back pain. I actually have a couple metastatic lesions in my back that did cause me quite a bit of pain. Since diagnosis, I have had surgery. I've had debulking surgery and had 22 tumors removed surgically. And then I've also had 2 liver ablations. I actually just had one 2 days ago. So I just had 4 lesions ablated at the National Institute of Health. And then I also had a liver ablation last year, had a surgery in 2023. And then I also did SBRT in 2024 on my spine, on the 2 lesions on my spine. So I've also do the SSAs, the monthly shots. And that's been my treatment so far. That does sound like a lot of treatment. And while the treatments are not always easy, my day-to-day life feels pretty normal. I also quit a job when I was first diagnosed, but that was simply just because I didn't know what was ahead. But I've actually had 2 different jobs since then, and I continue to work and be active in my community and with my family, and I have 2 dogs, and really, for me, life feels pretty full most of the time, and I feel pretty well most of the time when I'm not dealing with treatments. So,
Wow. Dusty, you've been quite the advocate for yourself. And thank you for also, I mean, there's similarities. You and David, you're both advocates, finding that experts early on in your journey, and also differences, right? David had symptoms. You did not have symptoms, and your cancer was found incidentally or, on a scan that came from looking for something else. So very interesting. And we'll definitely circle back to your experiences finding a net expert. So thank you for sharing your story. Let's go to Kimberly next and then Judd.
Great. Hi, friends. My name is Kimberly. I was born and raised in Hawaii and now live in Phoenix, Arizona. I have spent 25 years working in higher education in different roles and student services. But for the most of the time, I've been the teacher. I've been a professor teaching lifespan development, child development, as well as career development courses for undergraduate and graduate students. But I made my own career transition actually this month in May. I've spent 25 years in higher education doing a variety of things with student support and success. But for the most part, I've been a teaching professor for lifespan development as well as career development. And recently, I made my own career transition from higher education to healthcare, where I work now as a consultant with Banner Health here in Phoenix, where I actually help doctors and APPs build programs and initiatives and a mentorship program actually to help reduce burnout and increase what we call cultivating happiness in medicine is a program that I work for. So I was diagnosed in 2020. Many of us, I didn't have really any symptoms. I had, just like Dusty mentioned, chronic back pain. I attributed it to the interval training and the CrossFit burpees I would do, silly things back in the day when I was younger. But one summer, I was sort of prompted. I always think it's a God thing. Just like Dusty, I have a strong faith, and God kind of prompted me to get a mammogram, my very first mammogram at the age of 40. And I didn't really think anything of it. I said, let's just get a baseline, see where we're at. And I got the call that they found something and they were going to do an ultrasound, which I thought maybe it was something benign, but a biopsy showed that I had neuroendocrine cells and they didn't know where it came from. But I knew when I heard it from the breast surgeon who told me that it wasn't breast cancer, because that's immediately what I thought it was, but that it was neuroendocrine tumors. But when I heard about it being in my lymph nodes, I knew I had a metastatic case. So I was quickly connected with a general oncologist here in the Phoenix area and was diagnosed with high grade, what they believed to be lung nets. with metastases in my liver, as well as my lungs, my lymph nodes, my bones, and pretty much every bone in my spine has lesions in it. And I was told that it was a really aggressive case. I had different scans, including a PET scan, which lit up, which is interesting for my case. And I was told I had limited treatment options, but it was going to be very aggressive. So just like Dusty, I had a port put in, and on the same day I had the port, I also started radiation on my back, and I started chemotherapy that within 2 days. So I was on platinum-based chemotherapy. I did 6 rounds of etoposide and cisplatin, and I also did 4 rounds of immunotherapy, 10 rounds of radiation. And after 4 rounds of the chemo, we had kind of check-in scans to see how I was responding to treatment. Overall, I was feeling pretty good, actually. I pride myself to say I didn't once vomit or throw up during chemotherapy. I think that's pretty rare, but it also baffled the doctors because they said, you should be really sick now because the chemo is attacking, really aggressive cells, and that response, which is natural, is to have a lot of illness. But I really didn't. I was pretty tired, but I was still working full time, teaching, as well as, just resting, but feeling overall pretty good. I did lose my hair, but after 4 rounds, the scan showed no change. And at that point, it was confusing. I thought, well, at this point, I wasn't quite like the rest of my friends here on the panel, really diving into material. I think I was in still a sense of shock and almost fear, because reading things about high-grade NETs was scary for me, just even cancer itself, looking at maybe some of the different treatment options or limited options. Doctors weren't really optimistic or really hopeful in how they spoke about cancer that they had diagnosed me with. But I also didn't have enough resources and knowledge in order to advocate for myself. So when they asked for me to take an octreotide scan, which now I know is like an outdated type of scan, I went along with that. When it was, let's try immunotherapy, even though we're not sure it's going to work, I went along with those things. And I think it was a little bit of not knowing and not being able to advocate for myself, but also really I was raised to trust doctors, trust the doctors who I think are the experts. I think they're the ones who know more than me, and I'm sort of at their will. But once I met with, it was LACNets, so NCF was LACNets, connected with a support group and the different resources and learned more, then I figured I probably need to get a second opinion. So I had a case manager through my insurance company who was really a great resource for us and helped connect me to the Mayo Clinic here in Phoenix. And I was connected with Dr. Sonbal, who's a neuroendocrine specialist here. And I met with him after I completed all 6 rounds of chemo. I figured I'm kind of one of these people. Once I start something, I'll finish it. So I decided I might as well finish the 6 rounds. Finish the 6 rounds, still no change. I saw him in January of 2021. And at that time, it was such a relief. Gosh, can I tell you how different it was to me with him than it was with my initial oncologist? Not only is he so kind and just spent so much time with my family and I of educating us, but even was kind to say, if you're not ready to look at your scans, that's okay. But when you are ready, I'll be here to help walk you through looking at it together. And I think just the kindness that he showed, the patience that he had, as well as just the expertise. He then diagnosed me properly with well-differentiated NETs. It's grade 2. And while I do have lots of metastases and a lot of disease, what he said was that I could take a break from treatment, but that there were lots of treatment options for me to live a full life. And honestly, I have. I've lived since 2020 with cancer. This will be this summer, the 5th year of me alive and thriving with cancer. I've been on oral chemotherapy since 2021 and do really well on it. And it stabilized disease and just really given me a life that I'm so happy with. And so I'm thrilled today to be alongside all of you for us to give hope to other NETs patients and as well as their families and their caretakers and any other wisdom and perspectives that we can share.
Well, that's really incredible, Kimberly, that seeing a NET expert actually changed your entire diagnosis from a high grade to a well-differentiated grade 2, and what a difference that made in your whole treatment journey and your quality of life. How remarkable that is. I'd like to hear, last but not least, from Judd. Please tell us your story.
Thanks, Lisa. I'm Judd, and I live in Minnesota. I am a husband and a father of 3 kids, and I work full time as a public finance consultant. And probably don't know what that is, but I advise cities and counties on all sorts of financial issues. So it's a great gig. But in the last 3 years, I've become a net patient and advocate as well. So my journey started with progressively worse carcinoid syndrome symptoms. In late 21, I started to have diarrhea, intermittent of it was really hard to pin down what was going on. Like a lot of net patients, I had a number of dead ends in terms of doctors thinking I had a parasitic infection. Another thought I had developed a dairy allergy. I had a colonoscopy that, like many people, didn't show anything. Then my symptoms kept getting worse. I developed shortness of breath, facial flushing, rapid heartbeat, some of the other classic CS symptoms. And it was finally my primary care physician that said, okay, I'm going to open up essentially the medical version of Google and put in all of my symptoms and said, well, I think we should test you for a whole bunch of these strange types of neuroendocrine cancer. So he ordered a 5-HIAA urine test, and that came back very high. And that was sort of the start of everything in September of 22. And I was very lucky. I got a CT very quickly, also a biopsy very quickly. And so I was diagnosed as having stage 4, grade 3 small bowel NETs with metastases in my mesentery and liver. And I was very fortunate that the oncologist I saw here in the Twin Cities, even though he was a generalist, he knew enough about NET to say that I should either go to Mayo Clinic or the University of Iowa, nearby, both of them. I actually grew up in Rochester, Minnesota, so I was very familiar with Mayo, and so I went there. And within about a month, I was actually enrolled in a clinical trial to receive PRRT as my first line of treatment. This was the NETTER-2 trial. That went very well overall, but that shrank and stunted my tumors throughout. And I was then living with NET for about 18 months until last fall of 2024, and just receiving octreotide shot monthly during that time. But my team at Mayo and I discussed kind of my current disease state last fall and decided this would be a good time to go in and try to resect and ablate as many tumors as possible, especially some of the tricky ones that I had in my liver. And so I had a total tumor resection and ablation last November. That went very, very well. And since then, at least according to my last scan back in March, I have no evidence of active disease. We know that it's very likely that my NETs will reform at some point, but I was thrilled to reset the cancer button, if you will, and to not have to deal with active treatment right now in this phase. So I've been able to put more of my energy in helping other NET patients and getting more involved with NET advocacy as well.
Wow, congrats on having no evidence of disease. That's
Yeah.
exciting news, and something that oftentimes when we hear with cancers, and especially stage 4, having spread to the liver, you think that's not possible. Thank you so much, Judd. How amazing, right? We have 4 different unique stories with symptoms or lack of symptoms, different treatment journeys, how your cancer was diagnosed, and how you even went about making your decisions. And so I'd like to dive a little bit deeper. And we're going to start with the topic of navigation because that's really common, navigation and self-advocacy. Kimberly, we'd love to hear more about your experience with seeking that second opinion with the neuroendocrine tumor expert. And you talked about, of course, how that happened. What made you pick up the phone or make that move to finally, okay, it's time to get a NET expert opinion? And how did you even go about figuring out who to see?
Sure. Thanks so much for the question. So a lot of it had to do with the no response to the initial chemo, the radiation. I mean, the scans didn't change at all. I had no response. And to me, it seemed like even in my follow-up appointments with the doctor, my initial oncologist, he looked confused. I mean, he almost looked like he was studying my chart and really dumbfounded because I asked him point blank, well, what happens after this? Am I going to do another 6 rounds? I'm ready for another 6. Can I do another 6? He said, really, there's no other options after this. And it was at that point when I felt like there wasn't any options, is what he was saying. And I also was starting to read into more of the different resources that NCF and the support group was talking about, as well as my own research. And my mother was really fantastic. She had a book and she was doing the research. While I couldn't be probably brave and strong enough to do it, my mom was the one who really learned so much about the different differentiation, like the different grades and the different treatment options. So after I mustered up some courage, I talked to other providers. So I talked to my PCP, my OBGYN, other doctors who didn't know anything about NETs, but just really about the process of seeking a second opinion. I asked them, like, when should I seek one? Like, do doctors get their feelings hurt if and when patients come and ask for a second opinion? And they all said, no, we love for people to get a second opinion. This is important. And I think that I would encourage you to get one. And I would encourage all my patients to get one, especially when it has to do with a cancer diagnosis or big things like this. So it was through the case manager that I had through my insurance who helped me find a provider. It was great to read. I read up on the different articles that Dr. Sambal had published, and I put a call in to his staff to learn more about him. And I heard really great things, that he is not only well loved there at Mayo by his clinical staff, but by his patients. And it took about 6 weeks before I was able to see him. But what I was more impressed by when I met him, besides just meeting him, because he's amazing, was that in the 6 weeks, he actually worked with his neuroendocrine team there at Mayo to get the biopsy sample that the other provider had taken, and they reran the biopsy. And that's when I was properly diagnosed with PNETs and a lower grade well-differentiated case. And so it took, I think, a lot of, I also say luck too. And I think about faith in a sense that I moved to Arizona in 2003. Dr. Sambal moved just to Arizona to the Mayo Clinic a few years before our insurance actually was accepted by Mayo. And I think about all of these different people and places and opportunities and things and resources that just kind of aligned themselves to make that available. But one of the things that I did notice was that it wasn't, as I was going through treatment, it wasn't always the case for most people that I met. Some of them didn't have insurance that covered a lot of the costly treatment. And so for some people, it's just they lack not only it's just the resources. And that was really upsetting for me as I was navigating that.
Wow. Well, thank you for sharing your story. Many people will ask me, what is a second opinion doctor? What is another doctor going to tell me that I haven't already heard? How will it change anything? And you can see with your story how it completely changed things. What he told you was different. The pathology review ended up with a different diagnosis altogether. And you had a support with your mother in the case.
Yes. She was also great. And I forgot to also mention that Dr. Sambal even gathered a tumor board together before meeting with me. So he met with his colleagues across all the different Mayos, and they got together to review my case. And so that was really remarkable as well. I was just so impressed at how he cared about me before he even met me. You know, he cared about my case, and he saw the uniqueness, and he just gave me so much hope. And just before I met him and the team.
That multidisciplinary approach, how critical that is. Thank you, Kimberly. Dusty, what about you? You said you live in a rural area. I imagine there aren't NET experts around your area and even in your state. So what and how did you start thinking, oh, I need to see an expert? And then you said you went on this grand tour. How did you end up deciding on who your medical team would be?
Well, for me, I really wanted to make sure, the biggest thought in my mind was I didn't want anyone who loved me to look back and say, if only she'd done this, or I didn't want anyone to ever have to wonder, had I done everything that I could, especially having young kids. I didn't want anyone to have regrets as they, whatever the future held. And so that was kind of my first driving factor. Again, I was just really fortunate. Literally the night I was diagnosed, I found LACNets and Healing Nets and NetRF and Carcinoid Foundation, and I mean, I found them all, like all of them in Cal. I read about them all that evening, the very night I was diagnosed. And so I even found the Net Vitals tool, and I had a copy of my biopsy report, and I filled in all the information I could. And I had a appointment with a new oncologist that was local within a couple days of my diagnosis. And I went in with my Net Vitals tool, and I said, here's this tool and here's some blood tests I haven't had yet. You need to order those. And just looked at the names on those lists and said, okay, I'm going to go see those doctors. And so I finally ended up choosing the National Institute of Health and Mayo Clinic as my final places of treatment, and they coordinate together. I did join Dr. Del Rivero's clinical trial there, so I'm on her natural history study. And as a participant on that, I come there a certain amount of times for clinical review of my case, some standard blood work, but also an element to that is tissue procurement. And so I was also able to meet with the surgeon there, Dr. Jonathan Hernandez and his team, and I had my surgery there. I did consider surgery at Mayo Clinic, and there were a million reasons to make a million decisions. So kind of an interesting thing about my journey is within 2 months of my diagnosis, I'd seen all these doctors. And in this order, I was offered embolization plus Afinitor, the NETTER-2 trial, CAP-10 plus surgery, and then surgery again, and then surgery again. So when I had 3 surgery recommendations, I was excited to at least have some consensus, because originally when I had embolization, Afinitor, NETTER-2, which is PRT, CAP-10, I felt very overwhelmed with all these different recommendations. And eventually I got several lines of consensus, which at least was a comfort to me. And as I learned about some things and just was able to decide, okay, what are the side effects and what are my options and how do I use the tools in the toolbox and how can I stagger treatments and push things down the line? For me at the time, surgery seemed like a really good option. I think I failed to mention, so my Ki-67 is somewhere between 4 and 11%. The biopsy readings have varied. I have a grade 2 pancreatic neuroendocrine tumor. And so that gave me it's slow growing. Since my diagnosis, I don't think I've had new disease based on the scans that I've had, but I had a lot of disease to start with that we've tackled. So, but I really, every doctor I saw said something to me that made a huge difference and educated. Because I got to see all those doctors consecutively at the beginning, I learned so much and I really grew to understand this disease very well. And what I will say that is amazing to me about the neuroendocrine tumor sector of cancer treatment is that these doctors that have dedicated their lives to treating this disease, they are all so supportive of their patients, very open to patients getting second opinions. And I had one doctor at the very beginning say, listen, if you have a doctor that acts offended because you're getting a second opinion, that's not the doctor for you. And I think that's probably great advice. And he encouraged me to get second opinions and told me list of doctors to go to. And every time I went to a doctor, I'd say, okay, if I don't choose treatment with you, who would you recommend I would choose treatment with? Just out of curiosity, just to make sure I was kind of following the right path. And then ultimately, I do think that, especially when you see several different doctors like I did, it's somewhat like dating. Like, it's kind of a silly analogy, but there's just some people you click with and you feel more comfortable with. And there's people that all of a sudden you're around them and you feel your your walls come down. And for me, that's something I felt with multiple doctors. All of them really were wonderful, but there's just a point where you just feel understood. And all of a sudden, instead of approaching things like I'm advocating and fighting for myself, I felt like I could kind of relax and felt that was a person that was going to fight for me and I could let my guard down a lot. And so I will say, though, that there's multiple specialists that I saw that I have a feeling in my journey, I'll probably go back and talk to them again. There wasn't anyone that I met as I did my second opinions that I'm like, ooh, I wouldn't want to go back to them. All of them I would. And then the other big factor for me was just proximity and location. I'm doing most of my oncological care at the Mayo Clinic, but then having my cases consulted upon with Dr. Del Rivero at the National Institute of Health, and then having my surgical care at the National Institute of Health as well. But of all the places I went, that's the only place that has a direct flight. And that does make a big difference. Like, I got back at 9 p.m. last night, and I'm able to be on this call today after treatment at the National Institute of Health. So location does make a difference. When I go to Mayo Clinic, I have to travel for about 11 hours before I get there. When I go to National Institute of Health, it's a 45-minute flight. That makes a big difference, and it's something worth considering.
Yeah, proximity matters because you're thinking about long-term, not just like dating in the short term, but that long-term marriage.
Yeah, right, exactly.
So Judd, similar to Dusty, you had many different treatment options probably that came up for you. You both were diagnosed within these last few years where there are a lot more treatment options than there were 10 years ago. So as Dusty mentioned, she had a lot of different options. For you, I'm wondering what weighed into that, and perhaps what is one way you advocated for yourself?
Yeah, so I really jumped into research right away. Like Dusty, I found advocacy organizations like LACNet, now NCF. I looked at papers, I looked at video webinars and other presentations. And that was so helpful for me to be able to watch YouTube videos and watch some of these top net experts talking about, net 101 and treatments and sequencing. And I really felt empowered by that kind of research right off the bat. Still had a lot I needed to learn and a lot of questions, but I had a really rapid fire situation where I was diagnosed in early September of 22. And by the end of September, I was meeting with Dr. Thorheft Anderson at Mayo. And so it was really that research I felt like that gave me the building blocks, and I knew what questions I wanted to ask. It was really crucial that I had my wife with me as another set of eyes and ears. She was actually the note taker, so I could really focus on my discussion with Dr. Thor. And as he was talking about the different options, it just made sense that given my tumor burden and where my tumors were in particular, that PRT through the NETTER-2 trial was going to be the best option for me. And I also really liked that in the NETTER-2 trial, that even if you were assigned just to the high dose octreotide, you would have the ability to cross over back to the PRT if you had progression. I didn't want to, potentially be assigned to the less aggressive track and then be stuck on it, so to speak. I was assigned to the PRT track, so I didn't have to deal with that. But I looked carefully into the trial itself as well and made sure that I was comfortable with that as opposed to one of the other standard of care options.
Yeah, wow. So coming in informed, as with all of you, I mean, really coming in informed, reading the papers helped you have a more informed decision when it
Yeah.
came to that treatment conversation. You felt empowered and a sense of agency, and that was important for you. So, David, as a clinician and a patient, what are some tips that you have for navigating or tips for communicating with providers?
Well, I think the most important thing is to see a neuroendocrine specialist. Doing what I did in medicine, literally everyone came to me as a second opinion. So I always said to my patients, look, if you want a third opinion, a fourth opinion, I welcome those opinions. If someone has a better idea, that's great. We can talk about it. If they don't have any new ideas, then you'll feel more confident in the care that I'm giving to you. But with neuroendocrine tumors, I think it's just absolutely critical that you see a neuroendocrine specialist. So, as you well know from the groups that we're involved in, a lot of people are afraid to get second opinions and they're afraid to upset their doctor. And how's my doctor going to feel? Well, a good doctor is going to welcome it. So I would say that's the number one thing. The second tip I would have is consider either writing down your questions or perhaps tape recording your visits, but having an organized way of approaching your visits is a really helpful way to be sure that you cover all the questions that you have, that you get everything answered that you want answered. Lastly, I think being involved in the neuroendocrine community, which obviously everyone on this call is very involved, these communities are just literally chock full of good information and good experiences. And there's always someone on the call who knows of a doctor that they saw, that they liked, a treatment that they've heard of, something new that you haven't heard about. So I think being involved in the community and taking an active role in your care is really critical. And that's how you stay up to date, and that's how you know about advances in the field.
It's so true. I mean, these patient advocacy organizations in neuroendocrine is the source of information and the latest. And I know for me, I wasn't aware that My initial thought about support groups when my husband was diagnosed was that, oh, it would be a place where people are crying and, offering support, which is true, possibly, but really not understanding that these were networking groups and that there was high quality education and information being offered through these organizations that are very valuable, especially when you're dealing with a less common disease. Thank
Yeah,
you for that.
very, very much so.
Thank you, David. So, we've mentioned some of the challenges and we'll dive a little bit more into that. Judd, let's start with you. What has been the most challenging thing about this diagnosis for you?
I think it was getting used to the idea that this was going to hopefully be a chronic condition and not one that required, a heightened level of ultra urgency. With PRRT, you typically receive a dose every 8 weeks, and I found it very hard to be calm and have faith and confidence that this was going to work. I had done the research. I was, really comfortable making the decision to enroll in the trial, but when I was told I had stage 4 cancer, you think of friends with colorectal cancer or breast cancer that are having surgery and chemo and radiation and all the guns, right? And here I was going into the hospital once every 2 months, other than getting my octreotide shots, and that did foster some doubt. And so I think understanding that that's the way it was supposed to be and that this was a diagnosis that I would be hopefully living with, it just, I got there, but it took me a while emotionally and mentally to come to terms with that and to be more comfortable living in that space as opposed to just, fighting it with all I've got, for instance.
Yeah, the challenges of the psychosocial and emotional aspect of it. Thank you for
Yeah.
your openness with that. David, I know you and I relate in terms of changes of career and work with this neuroendocrine cancer space and the diagnosis. How has this affected, I guess, your sense of identity and the loss that you've had in terms of your work and career?
Initially, I was pretty lost. My home was Southern California, and I was born and raised. Had spent my whole life there, and was here only a matter of months. And suddenly life turned upside down, and suddenly I'm unemployed with stage 4 cancer. So it was pretty shocking at first. With time, however, it's opened up new doors, and I have found I had a lot more interest in oncology than I thought I did. So I have become much more involved in advocacy groups. I've explored numerous avenues to be involved, all the way up to the NIH, serving on committees that review study proposals and which studies are going to be funded and which are not going to be funded, but not as a doctor, but representing a patient. And there are times I sit there and I will listen to the whole study proposal, and then they'll get around to the so-called patient advocates, and I'll say, there's no way you're going to actually fill this study because patients are never going to sign up for this. They're not going to put themselves through the things that you're suggesting that they go through. It just wouldn't be worth it. So I found ways to integrate my medical background into my patient background, which I think are very valuable and quite fulfilling, honestly.
Wow, how beautiful that you've been able to find new ways to use your skills and your experience. Thank you. Dusty, you talked about being a mom of young kids, 4 and 7, when you were diagnosed, as well as a wife. How has this diagnosis affected your relationship with your family?
Well, I think initially, so for those first few weeks when I felt very well, but had was being told I had 3 to 6 months to live. I always sort of joke that the song "Live Like You're Dying" kept getting stuck in my head, and I'd be brushing my teeth, and I'd be hearing that skydiving song, and I thought this is very much not like how this actually feels. It's much scarier than that. So initially, I was very scared and trying to maintain normalcy for my kids. But eventually, as I started to grasp what neuroendocrine tumor was and the hope that came along with this diagnosis, and really just talking to other patients living with this disease for a long time, I started to realize like life doesn't have to change that much at this time, and we can keep on living. And so all of a sudden, I went from, trying to live life as though everything was changing to realizing that life could actually maintain a lot of normalcy. Because my girls were young, they sort of have taken things in stride as much as kids can. I think that they've adapted really well with it. And I've hoped and prayed for discernment as there have been reasons to talk to my kids about different things. So they understand that their mom has cancer. They understand that I have tumors. Initially, I talked to them about tumors because that word was not as scary to them as cancer, because we'd had family members with cancer. And so at some point, my oldest daughter, she asked me, she said, "Hey, so are tumors the same thing as cancer?" And I was like, "Oh, here we go." And really on the spur of the moment, on the spot, I said to her, I said, "Well, the word cancer is a lot like drinks. And there's all kinds of different drinks. There's chocolate milk, there's coffee, there's apple juice, there's all these different things, soda." And I said, if I had to say like what kind of cancer mommy has, I'd say mommy has apple juice cancer. And she said, "Okay." And really just moved on from that. So telling her I have apple juice cancer made a lot of sense to her when she was 7. Now she has more complex questions now that she's 10. And my now 4-year-old, who is now 7, she's understanding that her mom has cancer, but that's something that it's part of her vernacular now, and it's part of her life that she's used to. It's not scary for her in the ways that one might imagine. In fact, the other day she said to me, she said, "Mommy," she said, "do you know what our greatest miracle is?" And I said, "What's our greatest miracle, baby?" And she said, "That you didn't just have 3 to 6 months to live, and that you're going to be here with us for a long time." And I said, "Absolutely, like it really is." And so, they're learning to have gratitude in the midst of all of this. And I think a lot of it has to do with the way I'm able to face it. And faith has a lot to do with that. The support system I have, my husband and my friends, my family, have a lot to do with that. But also, too, just feeling empowered from all the medical professionals I've encountered who give me a lot of hope. And getting to know yourself, Lisa, and other patients, and just all the different people I've met. I have a lot of hope for what can happen in my lifetime with this disease. And when I know that there are people that were diagnosed in 2003 who are thriving with this disease today, the fact that I was diagnosed in 2022 gives me a lot of hope. And so the way I talk to my kids about this isn't overwhelmingly scary. And one of my mentors was Kelly. And early on, I talked to her and asked her, my biggest concern is my kids, and how has this affected your kids? And so her kids were around the same age when she was diagnosed. And then at the time I was speaking to her, her kids were adults. And she said, "Here's what I'll tell you about my kids." She said, "Because of this disease, my kids are spiritual giants." And she said the amount of faith and just the grit, and she just talked about the way this had shaped them into these very resilient people. And that gave me so much hope that this disease could actually help my kids become stronger human beings. And I tell my 10-year-old a lot, I'm like, "Girl, you're 10 years old and you already know you can do hard things. There are grown-ups that don't know that about themselves." So definitely try to reframe this a lot in a way that empowers my kids, and hopefully they'll grow stronger because of it. That's how I try to filter this into our lives and journeys, because it could be really sad and depressing. And I guess that's one way we could look at it. But we're also just really thankful at all the possibilities that lie before us for how this could go well. So
yeah, many people can be perhaps scared of how to talk about it with their kids. And thank you for sharing how that can be a positive experience, how it can help your kids, for lack of better words, they'll grow stronger and become stronger people. It's amazing how kids can mirror us, and they're mirroring your hope. So, Kimberly, I know you too have kids. How did you talk to your kids about cancer?
I have 3 sons, 3 amazing sons, Jacob, Noah, and Ben. And at the time of my diagnosis in 2020, they were 16, 9, and 7. So a big age difference in terms of how we talked about it. But honestly, when I found out, my kids were actually staying with my ex-husband at the time, because we were kind of really well into COVID and lockdown. And so it was his week to have them. And when I first was initially going through the scans and all of the blood work, he and his wife had the kids. And so he really volunteered to do it, tell them, which I think was a really hard thing. I mean, I was really in no shape to talk with the kids at that time. I didn't have the language. I didn't have anyone in my family who had been living with cancer, who went through cancer treatment. We were just so scared, and we were scared for them. And so looking back, it was really an act of caring that he had for me, and a way to protect me from having to do something that was really difficult. But he sat down with my older son, who was 16 at the time, with Jacob, and had a different kind of conversation than with the younger ones. Of course, one of the things they asked about, two things, was they were interested in my hair, if I was going to lose my hair, and then they asked, if is mommy going to die? And so he had to really kind of carefully navigate that. That death is a part of life. That mommy, what he said was that she's one of the strongest people I know, and so she's going to fight. She's going to fight for you all. And so he was really confident in that. And so I agree with Dusty that so much of our kids, they're so resilient. And my kids have learned so much about empathy and understanding for others. I've seen them grow so much, not only in their faith, but also their just gratitude about life, and the way that they have kept their hearts open to helping other people and their families who've been dealing with cancer. So my older son, he's a film student. He actually submitted a short film documenting my journey with cancer that he actually went up for an award here in Arizona. He also had supported his teacher, one of his mentors at school and high school, who was diagnosed with breast cancer while I was going through treatment. And we were able to bless her with a lot of really fun things to help her get through chemo. And then my younger two are in school. They have a $1 million challenge. It's a math assignment where they have $1 million and they have to decide how they're going to spend it. And it was just so heartwarming to see them include donating to neuroendocrine cancer research as part of their $1 million of spending. Of course, there were things like Lamborghinis and Disneyland and candy, but within there was a donation to continuing the research. And that was neat to see, because we do see our kids can see us do hard things. And I think that it helps them, but they also see that we continue to live full and happy lives. And so the word cancer, while it can be scary, it's less scary to them. And they understand that as parents, we do mirror and model so much of how to handle things. We can't control a lot of things, but we can control how we respond to them and how we rally together as a family.
Wow. The resilience of your kids, Kimberly and Dusty, is really inspiring. Thank you for sharing those stories. We'll go to David, followed by Judd. One thing we often hear from those living with neuroendocrine cancer is that people say to them, "But you look so good." How do you feel, David, when people say that to you, and how do you respond?
Initially, that was hard for me because I thought, if you only knew. But now I just say thank you. I don't actually pay a lot of attention to it. I know that neuroendocrine cancer is the so-called pretty cancer. So people tend to look better than they maybe are inside. But it doesn't honestly really bother me at this point in my journey. I'm glad that I don't look like someone who has an awful disease, and that I can just blend in and actually look the way I mostly feel, which is mostly good. So I'm fine with that.
You're okay with that, even though it's different than how you feel on the inside. Judd, what about you?
Yeah, so I described the difficulty I had in getting to grips with this idea of having a chronic but hopefully manageable condition. And more than that, I really did fall into some depression and have some anger, I think, with my body for betraying me, so to speak, by developing this cancer. And so I really struggled to know how I wanted to respond to people, because I was struggling to really know how I felt as an individual having this diagnosis and undergoing this treatment, and it all happening kind of quickly. But really, through talking with other NET patients and also really talking with a lot of other men who have cancer, I was able to get comfortable again with my situation and be able to accept help from friends and family and to take their compliments and I guess encouragement without having kind of a chip on my shoulder. So that was a little while. And I do want to note that it's striking to me, Lisa, that when you go into various support groups or Facebook groups, there are so many women that are advocating on behalf of their male relatives, whether it's wives for husbands or mothers for sons or daughters for fathers. And I've really made it a mission of my own, and I'm quite passionate about helping other men with cancer, not only NETs, but other types of cancer as well. Realize that, there are means of support and how important it is to be empowered and take agency for your health journeys, because there are a lot of men that go into that bunker mentality and say they have to just sort of, man up and tough it out. And that's in most cases the absolute worst thing to do, right? You need to open yourself up to peer support, to family support, and realize that that's not a weakness, but actually a source of strength to do that. So that's what I did eventually. And I'm feeling a lot better now, both emotionally as well as physically, for having built those connections.
Openness and honesty takes courage, and it is
Yeah.
strength. And both of you, thank you for sharing that, how you've taken care of yourselves. And I think that's what's led to being able to reframe some of what is going on and your response to other people. So on the flip side, Dusty, we'll start with you, and then Kimberly. What advice would you give to family or friends of someone with neuroendocrine cancer on what they can do or avoid doing while they're trying to provide support?
A thing that has surprised me since being diagnosed with cancer is I've had friends or family members be diagnosed with cancer or another serious illness, and I've still found myself sometimes at a loss as to what to say or do, because at the end of the day, anybody dealing with any kind of major diagnosis, they're an individual. And so it has to be an individual approach, and you have to have some sensitivity about what the individual needs. For me particularly, I really appreciated the people that were just still around to make me laugh and be goofy and treat me like they've always treated me and not really handling me with kid gloves. For me, that was hard there for a while, where it was like people came up to me and were saying like, how are you doing? And I knew that they meant well, but for me as an individual, that I didn't like to be pitied. That really bothered me. And now that season has passed. I think now that people see I'm living healthy and well for a long time, I don't get that as much. And I don't begrudge anybody. It didn't hurt my feelings. It was just hard for me to navigate having people feel sorry for me all the time. At the same time, I'll also say that I think if you think that you should do something for someone, it's probably a good idea to find a way to do a kind gesture. Obviously, you want to respect people's boundaries. So maybe you don't barge your way into their house and clean their house if they don't want you to. But at the same time, you could, like, I had someone offer to hire me a house cleaner, or I had people just send me gift cards for food or drop off food, or offer to help take care of the kids or invite them. I think it's particularly helpful instead of people saying like, how can I help? Or let me know if you need help with the kids, or let me know if you need food. When the people reach out and say, hey, can I set up a meal train? Would it be helpful if I took your kids to this camp or to this activity with my kids? Or giving specific tangible offers, or even just sending gifts. Like one thing I did, because our family has several food allergies, we were really hard to cook for, and I had people reaching out all the time to cook for us. So I actually made an Amazon wish list of just a whole bunch of things my kids would probably enjoy, because I knew I'd be traveling a lot. And I just said, hey, if you'd want to do something for the kids, like here's a wish list of things that would really bring them joy. And they were like little craft kits and stuff, because I knew for a while they'd be in care of other people quite a bit while I traveled. And so my kids got like probably 50 gifts from Amazon over those first 2 months. And they really enjoyed getting gifts from Amazon constantly from people with little notes that just said, hey, we love you guys. And so that gave people a tangible way to help our family without them having to say like, what can I do? I just said, hey, I've got this thing that would be really helpful to my kids. And so they really enjoyed that. And a lot of people really took advantage of that, since we weren't easy to cook for. We've got a gluten allergy, a dairy allergy, and a carrot allergy in my family. So
yeah, thanks for that little pearl of wisdom. Specific asks and offers are helpful. Kimberly, what do you have to offer?
I love just going off of what Dusty had shared, this idea of having a sense of normalcy. I used to have friends who they would either always just want to talk about cancer, or ask how I was doing, which is, it was nice to be asked, but I didn't want that to be all of the conversation. I didn't want that to be the focus because there's more to me than the cancer that I have. And so, or they would often shy away from sharing what was going on with them, the fights they were having with their partners or their kids and just life things. They were sort of reserved about sharing some of those difficulties. And so I really had to say, hey, like, we could talk about all these things. I'm still me, and I still want us to have a genuine and authentic relationship. So I would say that. My husband, when we were diagnosed, we were only married for a year. And so it was quite a navigation for us to navigate this path. And I've been so, just been privileged for me to come alongside to watch how much he's grown. And so I asked him this morning, can you make a list of things that you would like to suggest for providers and caretakers and what you would tell them? And so the first thing he said was to educate themselves. So educate themselves on all things NETs, be able to know about the different treatment options, especially if the patient is not someone who's, like for me in the very beginning, really shying away from diving into these things because it was such a scary time. The second thing he said was to support your loved one in all things. And I joke about this in many ways because I literally probably can't even open a piece of mail without him right there because I don't have fingerprints with my treatment. And so holding onto things, grasping and opening things. He does all the dishes. He's great at doing laundry. So he does support me in all of these things, as well as my appointments coming with me. But he also said to find support from other people who are caretakers and also to be good with and encourage time for yourself to recharge. Because as he says, like, you really have to put forth your needs in order to take care of someone else. So I thought it's been really great to see him in the past 5 years, 6 years actually, grow into this amazing caretaker who continues to love me and to support us and our family and has really just done so much to be a good care for me so I can help to heal and rest and take care of myself.
Yeah, some helpful tips. And thank you for highlighting the need to put out the oxygen mask on ourselves before someone else, whether you're a caregiver, family member, or the person living with the disease.
I would agree. Something that meant the most to me is when people were providing support to my husband or my kids. Because you worry about the people that you love when you're going through this. And even my mom, there was a lot of people that were really supportive to my mom. And so just the people that showed up and were there for them too, that meant a ton to me.
Yeah. Caring for our loved ones speaks volumes. I know it does for me too. So we'll end with this last question. What are some lessons you learned or perhaps something you might say to someone diagnosed with neuroendocrine cancer? Judd, I'll start with you and then go to Kimberly, Dusty, and end with David.
My number one thing I learned was that I should have tried harder to stay active. I had a lot of fatigue with PRT. That's pretty common, both right after the treatments as well as for a while afterwards. But I think due to that and my depression that I had, I really kind of let myself go. And some of that was maybe also this anger, right, at my body for betraying me, so to speak. And I think I really suffered by not being more physically active. You know, we all have different abilities to do that, right? A lot of us have symptoms that might preclude a lot of physical activity, others not so much. So it really has to be based on your capacity and abilities. But I wish I had been more physically active earlier in my NET journey. Now that I am more physically active, I feel so much better and it just helps me mentally, emotionally. And I know that the next time I have to go into treatment or have another surgery or whatever the case might be, I will be better prepared physically for that. So I am a big fan of indoor rowing. I do indoor rowing and some strength training as well, walking my beautiful golden retriever, Juniper. And that's all made me a stronger person all the way around.
Yeah, staying physically active. Thanks for that tip. Kimberly?
I would agree. Physical activity is really important. The first oncologist I went to said, stop everything. And I went from going and exercising most days of the week. And he said, don't do anything. You need to lay like broccoli. And that's the way the treatment's going to work for you. And unfortunately, it didn't really work that way. So I definitely agree about just overall wellness, taking care of ourselves. I think it's, for me, I would think of emotionally, it's looking at it from a different perspective. I think being diagnosed with cancer can be scary. It can really just jar you and just throw you off and off kilter, and it can take a while, and mental health issues can set in, as well as just trying to figure out the why. Like, why is this happening? And it took me to the point where I had to kind of think about, why not me? I had to think about the purpose that God has placed into my life, and the purpose that He has given this opportunity for me, I guess, living with cancer. And I would say focusing on that has been life-changing for me, to think about how to use this experience to help others. And I would say that my purpose in this lifetime here on earth is to live and thrive with cancer, so that I can help encourage, come alongside others to give them that hope, and that they can do hard things too. And so I think that having that perspective has really been life-changing for me.
Yeah, knowing what your goals are in life and your reason for living and how to pay it forward. Thank you, Kimberly, for paying it forward. Dusty, what about you?
Well, first of all, I think, I appreciate the vulnerability that everyone shared. And I tend to talk in all terms of just hope and happiness in the future and all the good things. But there's been hard parts to this journey as well. And so very early on, I got signed on with a counselor. And so I did go to counseling. I have really dear friends that I've been able to be open with and talk to. So I think just making sure that you have people that you can talk to and be your real authentic self with is really important. Even if that is a counselor, if that's the safest place for you to do that, I think that's a really great tool and an important thing to have. For me, spiritually, my church has been a great resource for that as well. As far as just general, things I would tell newly diagnosed is that, of course, this is scary, but there's a lot of hope. And so second opinions and third opinions are great options to help you really understand your disease. And there are obviously a lot of things that can feel scary about cancer, but navigating this disease should help you feel empowered through knowledge and support. And finding the right caregivers can make a huge difference in that. And so if you're feeling unsupported, then if you have the fortunate opportunity to be able to seek second opinions, then I would highly recommend that. And then just continuing to live life. I am a person living with cancer. It is a very small part of my identity, and I don't think about cancer every minute of every day. It's a part of my life. It is not all consuming, and just knowing that can be on the horizon is if I'd have known that 3 years ago, I might have taken a deep breath a little earlier than I did. So I'm generally living a lot of life that has nothing to do with cancer, and I would have liked to have heard that from some other people early on in the journey as well.
Yeah, we heard all those words from all of you: shock, fear, overwhelm. And now thank you all for sharing how you've been able to manage and find a path forward, find some hope and a way to balance all of that. David, let's end with you.
I think for someone who was lucky enough to know the first day of college exactly what I was going to do in life, this has taught me that life is actually full of uncertainty. And uncertainty is okay. And that's part of what makes life fun. And you can actually embrace uncertainty. Two other things that I have learned. One is that there is always hope. And you should never give up on yourself. You should never give up on others. And hope is always there. And I think the last thing that I've learned is that it's never too early to tell the friends and the family, to tell them that you love them, so that they know early on and often how important that they are to you. So
I'm going to go tell my family that today. Thank you all for your honesty and openness, for sharing your insights and your pearls of wisdom. You all inspire me, and I'm sure you inspire the community. Thank you all for being here. And now I'll hand it back to Heather in the studio.
A special thank you to David, Dusty, Judd, and Kimberly for openly sharing how living with neuroendocrine cancer has affected you and how you continue to live well with this unique disease. We appreciate our supporters, Novartis, Ipsen, Exelixis, Crinetics, Curium, ITM, Boehringer Ingelheim, and Inner Science Institute. Educational programs like today's are also made possible by donors like you. Please consider making a donation today at ncf.net/donate. And a special thank you to our technical director, Rich Tamayo from TVP Live, for this high quality broadcast production. Again, today's presentation has been recorded and can be viewed on our website and YouTube channel shortly after this broadcast. If you register for today's webinar, you may receive a survey via email. We would greatly appreciate you completing this survey as it helps us affirm what's important to you in our educational content and in our fundraising efforts. To receive our reminders and news, be sure to add events@ncf.net to your Safe Sender contacts and whitelist email lists. Again, follow us on social media to stay up to date on our upcoming events. Our handle is @NCFCancer. And now back over to Lisa.
Thank you, Heather. The Neuroendocrine Cancer Foundation is a community of support and resources. We recognize that you are more than your disease, and we aim to support you as a whole person. To this end, we offer many resources and programs. Find out more on our website, ncf.net. We offer a monthly podcast featuring experts who answer the top 10 questions in their field. Go to our podcast page to check out the episode transcript, resources, and the 10 questions we asked the expert. Thanks again for joining us today. Goodbye, and see you at our next event.